Hi, Dr. Willis. My name is Joseph E. Zibor. I'm a student of University of Massachusetts Global. Today, I am presenting the second medicine for my patient teaching in this class, and I'm presenting paroxetine, which is Paxil. In this presentation, I'm going to focus more on the general information, the introduction of Paroxetine Paxil, what it's been used for, the administrations and side effect of it, how it works, and I will put more emphasis on patient scenario. I'm going to talk about two different patients and be able to determine which of these patients will paroxetine be recommended to, and which of the patient that cannot have paroxetine. I will talk more on special instruction regarding the medicine. I will talk about the black box warning, the FDA black box warning, and this is the class NURU 641 with Dr. Willis. General information on paroxetine, the the FDA approved treatment option for adults only for major depressive disorder, obsessive compulsive disorder, panic disorder, social anxiety disorder, generalized anxiety disorder, post-traumatic stress syndrome, and premenstrual dysphoric disorder, the menopausal hot flashes. For kids, there is no approval on this medicine for kids. This is very important for us. This point is so important where the FDA only approves it for age 18 or older can only take paroxetine. How does paroxetine work? Paroxetine is thought to work by increasing level of serotonin in the brain. They do this by blocking the recycling of the released serotonin back into the nerve ending. Paroxetine is often prescribed along with therapy, usually serve as harmonizer of the chemicals in the brain, especially in the neurotransmitters that affect the mood and the emotions of an individual. Administrations and side effect of paroxetine. Administration of paroxetine, it may be administered at any time of the day, depending on the toleration. For adult, adult can start with 20 milligrams by mouth daily and increase by 10 milligrams weekly, with a max dose of 50 milligrams per day. For older adult, we usually start them with 10 milligrams by mouth daily, then increase by 10 milligrams weekly, with a max dose of 40 milligrams per day orally. What are the common side effects of paroxetine? These are agitation, chest pain or chest tightness, chills, cold sweats, confusion, difficulty breathing, dizziness, faintness, lightheadedness when getting out from a laying or sitting position, fast pounding or irregular heartbeat or pulse, muscle pain or weakness, skin rash. This was our first patient that came into the clinic. His name is Matthew. He's a 31-year-old English-speaking Caucasian male, recently diagnosed with major depressive disorder, with an increased depressive symptoms over several months. He expressed that he is feeling very unhappy and lost of interest in doing anything. His past medical history, he has a past medical history of HSV2, of the simplex virus, and vitamin D deficiency. Matthew works as an insurance broker, is married, and blessed with five kids of ages 10 months, 2 years, 5 years, 7 and 8 years, respectively. And as we can see, he has a family history of major depressive disorder and generalized anxiety disorder. And Matthew has a very strong family support. He's a non smoker and he doesn't take alcohol or drugs. Now, with this patient, should paroxetine be recommended? The answer is yes. Matthew presented to the clinic with no suicidal ideation or homicidal ideation or thoughts. His GAD-7 scoring was 12, GAF was 60, PHQ-9 was 16. Matthew was cooperative, coherent speaking, though his mood was depressed and anxious, affected flat, and thought process. Otherwise, a Matthew is appropriate. So the diagnosis for Matthew today is the MDD and GAD, major depressive disorder, and generalized anxiety disorder. And I will recommend Matthew to start on 20 milligrams of paroxetine tablet PO daily. Then he can increase it every week by 10 milligrams till it get to a max of 50 milligrams per day. Our second patient that came into the clinic, brought in by mom, its name is Brittany. She's a 15-year-old African American female in her sophomore year of high school. She weighs 261 pounds with a BMI of 43.6. She described being able to sleep for up to 16 hours at a time, yet still experiencing fatigue and lack of energy every day. She expressed feeling sad at all times. A past medical history of diabetes type 2 and hypothyroidism. So, Brittany is a type 2 diabetic patient and hypothyroidism, overweight and obese patient. And she is currently on metformin of 100 milligrams tablet POBID every day and gluburide 5 milligram tab PO daily and levothyroxine of 112 microgram tab PO at the end on an empty stomach. And she's also taking the Monjaro shot, the semaglutine's Monjaro shot, and she's on the highest of 50 milligrams sub-Q every week. And she's taking that because of her obesity and type 2 diabetes. And at current lab, hemoglobin A1C was 6.9, and at TSH, which was 5.8, little bit elevated. She's having a strong family support, non-smoker, no alcohol or drug use. And should paroxetine be recommended on this patient? No. The reason is that paroxetine are not recommended for kids. According to the FDA, most adult age 18 and over can, can take paroxetine. And also, if you have diabetes, that's another important point here. If you have diabetes, paroxetine can make it more difficult to keep your blood sugar to be stable. So paroxetine is not recommended on this patient due to those two reasons. She's less than 18 years of age and she has diabetes. Rather, I would recommend maybe a Lexapro on this kiddo. Brittany came in with no current suicidal or homicidal ideation. GAD 7 scoring, GAF was 57, PHQ-9 was 12. She was okay, otherwise appropriate. We're diagnosing her with major depressive disorder. and we're recommending 10 milligrams of citalopram tab PO daily. Your instruction on Paroxetine. Talk to your doctor if you're experiencing any worsening mood or suicidal thought. Do not stop this medication abruptly. You need to taper this medication down. Avoid the use of other meds that may increase the risk of depression or exacerbation and suicidal. One thing with paroxetine is it has a very high drug-to-drug interaction. Box wanted for paroxetine is majorly with the concern of suicidal thoughts and behavior. These are my references. In case of any question on paroxetine, I can be reached via my email. Thank you for listening. Thank you.